Today, we're going to talk about qualifications for Medicaid. Listen up. First, if you don't have money. Second, if you're old or disabled. Medicaid will protect you. Check, check, check. 3. Medicaid also takes care of the health of both the mother and the baby. Fourth, what about the kids? They get Medicaid benefits through the Children's Healthcare Program, CHIP. Also, it depends on the situation, so don't forget to sign up for the program that suits you. Now, let's talk a little bit more about your qualifications for the Medicaid. All you have to do is go to your nearest state social worker. Or there's a website, and you can enter basic information about your income, your family membership, your health, and they'll tell you what kind of Medicaid you need. Furthermore, the qualifications may be more flexible in certain cases. For example, people with chronic diseases like HIV or certain disorders or diabetes, they can get extra benefits. Oh, and more importantly, the Medicaid requirements can change depending on the state you live in. So you need to pay attention to what they say. For example, some states may have higher income baselines, and there are places that expand Medicaid and offer a variety of services. Of course, some of the paperwork and procedures required for the Medicaid application are incorrect in each state, so we'll have to find the right information. On the state's Medicaid website, Medicaid has different qualifications for you in different states. Whether you're poor, old, pregnant, or sick, it's designed to give you the benefits you need. In the end, if you want free healthcare, don't forget to check the qualifications of Medicaid. If you want in, you have to look at the money you're bringing in. If your income is below the state-mandated Medicaid income criteria, you'll be eligible. Then, the number of family members is important. The bigger the family, the higher the income criteria. Because it's different when you're single and live in a house of 5. And your health, we need to take a look at this. If you have a chronic illness or a disability, it's easier to qualify. Don't worry, you can easily find this information on the state's Medicaid website or the Social Services Office. And one more thing, in some states, there are sweeter benefits for people in certain situations. For example, pregnant women, people over 65 years old, and people with certain disabilities can receive additional Medicaid support. Okay, let's look at the Medicaid application process. The first step is to go online, call, or directly to the Social Services Office and fill out the application forms. The requirements are different from state to state. But basically, you need to have your ID, income certificates, family members' information, medical reports, things like that. Once you apply, the government and insurance companies will review your qualifications and tell you what programs are suitable for you. Instead of trying to figure out what I want to do with my life, for example, if you have allergies and you need to go to the doctor a lot, they'll find a plan that covers all the treatments and medications faster than you think. They'll tell you when you can get the benefits, what hospital you can go to, what coverage you can get. And don't forget, things can change after you apply for Medicaid. If you have any changes in income or family members, you have to update them, even if it's a hassle. Otherwise, you might not get the benefits later. Also, it's important to apply to a real website that's not a fraud. Now, the disability pension. It's a system for people who are disabled and can't work. And it has qualifications similar to Medicaid. Your disability has to be on a legally mandated disability list. They also need to know if you paid your premiums for the duration of your work. Now, the application process. First, you'll need to fill out an application, a medical report, a doctor's note, a diagnosis, and a testimony from your family. All you have to do is apply to the state's Social Security Agency or their website. Yeah, well, for disability pensions, you have to be tough on your situation. First of all, you have to understand that this is a little different than Medicaid. They start with, is your disability really serious? Does it affect your basic everyday activities like walking, sitting, standing? It's okay if it's not on the legally mandated disability list. It's okay based on the severity of your case. Gut-wrenching. And most importantly, based on how long you've worked, the insurance you've paid. We'll make sure that you get the right support. You may not know what to file, but you can find details on the Social Security website. It's got a list of all the forms you need and the specific procedures you need to apply, so just follow along. By the way, applying for disability pension or Medicaid takes time and effort. Filling out forms, gathering documents, and sometimes patience. But all of this is for you and your family, so let's get through this. Besides, don't you think our health is the most important thing? Medicaid and disability pension are already a great system to make sure we can afford to go to the hospital. Don't you want to share this information with your friends? SSA, Social Security Administration. In the U.S., this place not only handles disability benefits, but also benefits for the elderly and families. When you or your family are in trouble, they're there to help you. You know SSI? It's short for Supplemental Security Income. It's usually for the elderly, the disabled, and people with very little income. To get SSI, you have to have very little income or very little property. But if you get SSI, you can get Medicaid with it, so you don't have to worry about the medical bills. You can apply on the SSA website, on the phone, in the office. You'll have to prepare for the interview. So make sure you check all the information you need for your health and life. These are the benefits that will help you through tough times. Checklists from the SSA site will help you. You also need to understand the application process, so talk to an insurance specialist or a lawyer. Your health comes first, so talk to a specialist, attach the necessary documents, and apply accordingly.